Okay, the setup for this is instead of the normal horizontal version of the radiograph, you want to turn it vertically and place your bitewing tabs vertically. Same with the anterior teeth, you place the film vertically and then you're going to place the tab on there. And I'm using the size 1 film to be able to get the anterior teeth because the posterior size 2 films will not fit. Go ahead. I'm going to take the tab and give it a little bit of a bend so that I can hold it in her mouth easily. And I also give the film a slight bend. If you give it too much of a bend, it's going to show that bend on the film itself. So just a slight bend. When you place it, you lay it flat in the patient's mouth. I'm doing the molar shot. You're going to slide it next to the tongue there. And then I hold the tab, and as she closes, I hold the side so that it will go right along the roof of her mouth easily and not just stab her. And then you're going to line the PID up just for your normal posterior bitewing shot. So I usually take the center of my PID and I line it up with the corner of the patient's eye. On the tab for the premolar shot, give the film a little bend and then lay it flat, sliding it next to her tongue. And then I'm going to have her bite, and I'll hold that so that as she bites it doesn't stab her. And then as we bring the PID forward to take the premolar shot, you want the center of the PID to line up kind of with the edge of her nose right here to be able to get that shot. Anterior canine shot, you're going to take the size 1 film and we're going to place it right here over the canine area. So the center of the film is, or the center of the tab is right next to the canine. So I'm going to have her slowly bite. I'm going to hold it as she bites. And then as we line up the PID, we're going to line it up right, the center of the PID right with the canine itself. And then we would expose that film just like that. Anterior shot, you're going to place the film in right in the center, and then I'm going to hold it as she slowly bites. We're going to line the PID up right with the centrals. And take the image there. And then for the last canine shot, I'm going to take it, line the tab up with the center of the canine here, and as she bites, I'm going to hold it in place. And then as we line up the PID on this side, right with the canine in the center of the PID. Then you'll just continue on with your premolar and molar shots.